Hi, I'm Dr. John with Pro Chiropractic, and we're back again demonstrating the pulse wave machine. Now, we did an introductory video, so if you haven't seen that, you might want to dial back and take a look at it, where we explained the unit itself, the treatment heads, how all of this works, but we're going to explain specific treatment today. And so what we'd like to do is to show a sample treatment of the instrument itself. We'll look over at the sound heads here. You can see that we selected one of the sound heads that we would use. Again, compressed air comes through, vibrates a metal bullet back and front, producing kinetic energy, which then is translated into sound waves. And we're going to demonstrate a treatment that we would use for carpal tunnel syndrome. So the instrument itself has the sound head attached. We would go ahead and put a little bit of conductance gel. This is normal ultrasound gel. And we have the lovely Allie with us today, who would be demonstrating on. So for carpal tunnel, we're going to work throughout the fascia of the forearm, but especially into the input and the outer part of the carpal tunnel. And so we're going to turn down the intensity to a reasonable rate, and you'll hear the pressure wave unit vibrating the bullet back and forth. That's sending focused waves of energy into the tissue. And what the patient feels through this is some tenderness in the most inflamed areas. Sometimes a referral of pain into the fingers, or a reproduction of the numbness that they may have felt initially. Now, if we wanted to change either the intensity or the frequency, that's how fast or slow the rate goes in, we would turn the intensity up that way, turn the frequency up that way. We'll just turn it up only slightly for Allie here. But you can hear the rate is much quicker at 17 than 14 hertz, breaking up the adhesions in the tissue through here. So this is where we would work for carpal tunnel. A great non-surgical alternative. Now, if we were going to utilize this same treatment for tennis elbow, we would move up, and we'd be working right into the outer part of where the extensor tendons go into the lateral epicondyle. And there's definitely some tender areas through here. We'd be able to pinpoint those areas. But again, we would probably work into the lower part of the upper arm, through the distal tricep, into the common extensor tendon, finding and localizing the tender points. And at these tender points, we would probably stay for 300 to 400 pulses. You can see that the treatment sound head itself is counting the number of pulses. For a normal treatment, we're somewhere between 4,000 and 5,000 pulses at varying amounts of intensity and rate with different sound heads. If you have any questions, please post those below. We're going to demonstrate a series of pulse wave or pressure wave treatments. If you have anything you'd like to see, please let us know. Again, Dr. John Wilhelm with Pro Chiropractic.